TAMar, transanal mucopexy and repair, 3-part surgical proctoscope for visual examination of the rectum and as aid in rectal procedures. With this innovative proctoscope, hemorrhoids and protrusions of the rectal tissue, such as prolapse of the rectal mucous membranes or rectoceles, can be treated in a particularly gentle, straightforward way. It can be used to visually examine the rectum or to assist with rectal procedures such as mucopexies or rectoanal lifting. TAMar is a 3-part adjustable proctoscope that enables treatment to be performed with minimal or no pain. It consists of an inner tube with window opening, an obturator that is pushed into the tube and securely locked into place, and a fixation ring with handle to which both are affixed. TAMar is easy to use, saves time, and ensures that everything proceeds with minimal complications. This means that rectal procedures create only slight disruption to patients' professional and social lives. For operators, TAMar offers a minimally invasive, highly effective treatment method with a very short induction period. To use the TAMar surgical proctoscope, the patient should first be placed in the lithotomy position. The area to be operated on should be covered in a sterile manner. Depending on the indication and the patient's preference, local anesthetic and mild sedation can be performed. Alternatively, spinal or general anesthesia may be necessary. The proctoscope is then assembled, its outer surface coated with lubricant and carefully guided into the prepared anal canal. The handle of the proctoscope is positioned straight down during this process. The slip-resistant thumb tray features small elevated sections and offers a secure grip. The proctoscope is pushed into the anorectum until the fixation ring reaches skin contact. Subsequent adjustments can be undertaken depending on the patient's individual anatomy until TAMar is perfectly positioned. Even simply inserting the proctoscope pushes any prolapsed tissue back in position. Sutures are then inserted perianally via the 3 holes on the fixation ring to affix the proctoscope. The TAMar surgical proctoscope features 7 positions at which the inner tube can be locked into the fixation ring. The thread holder to which the suture material can later be affixed indicates the precise location of the tube's window opening. This can be set at 1, 3, 5, 7, 9, 11, or 12 o'clock. The tube and obturator are first detached before the tube is positioned as desired outside the anal canal and relocked into the fixation ring. The obturator can now be removed. A diagnostic examination or a surgical procedure can then be undertaken on the exposed part of the anorectum via the window in the inner tube. For instance, prolapsed tissue can be repositioned using various sutures. To achieve this, 1 continuous suture using absorbable material is inserted for each position. This starts with a Z suture at the top of the anal canal that initially compresses the vessels feeding this area. An over-edge suture, which is subsequently drawn together, can then be used to pull together connective tissue and mucous membranes and tighten the area. Once treatment of a particular area exposed by the window has been completed, the obturator must be reinserted before the inner tube's position can be changed. This prevents the tissue from being damaged. After repositioning, the obturator can be removed and the procedure repeated. If treatment is being conducted at multiple window positions, an alternating approach is recommended to reduce tissue tension. The following order is commonly used. Start at 11 o'clock, move to 1 o'clock, then to 9 o'clock, and move in the opposite direction to 3 o'clock, then to 7 o'clock, and finally back to 5 o'clock. If a rectocele is present, the 12 o'clock position is recommended as a starting point to prevent the tissue from sagging towards the vagina. The order is then followed as described. Once the procedure or examination has been completed, the sutures affixing the fixation ring can be removed. The proctoscope with the obturator inserted can now be fully removed from the anorectum. Treating hemorrhoids, rectal prolapses and rectoceles generally takes 30 minutes with this treatment method. Patients are able to sit or walk just a few hours after the procedure. TAMar is an innovative proctoscope It enables treatment to be conducted with minimal or no pain. It is easy, reproducible and time-efficient to use and can be revised if necessary while offering patients a procedure with minimal complications. TAMar can be used in various ways, both diagnostically and surgically, as a tool for the innovative, effective treatment of hemorrhoids, rectal prolapses and rectoceles. Please visit our website or contact us for further information. Thank you.